Good afternoon, everybody. We'll give everybody a moment to filter in here before we get started with our interview for this afternoon. Thank you all very much for joining on a unfortunately rather gloomy afternoon in Tokyo. I hope everyone is doing well there. Just waiting for all of our panelists and attendees to join in here. In the meantime, how's everybody doing today? If you want to, feel free to use the chat tool. Let me know where you're calling in from and maybe if things are looking any better outside for you guys this afternoon. Staying dry indeed. Hey, good afternoon. Can you hear me okay?
Yeah, it's okay.
Excellent.
I got some problem to enter the Zoom. Sorry.
That's okay.
I'm sorry.
A quality of the modern age.
Yeah.
So for the benefit of our viewers, Phyllis, thank you very much for joining us from rather far away today.
Thank you very much for your invitation.
My pleasure. Before we get started, could you quickly just tell us a little bit about who you are and maybe some of your past and current career points?
All right. Actually, I'm from Taiwan. Okay, and my name is Phyllis. I have been in the medical and health industry for more than, wow, they will be tell my age. Okay, more than around more than around 20 years already.
Okay.
So which means I have been working with the hospital, clinics, and healthcare institution, and academic like the university, not only in Taiwan, also abroad. Okay, since the past years.
Okay.
Especially for the smart solution like a smart hospital and the smart healthcare and the smart health city, etc.
Okay, so IT and healthcare integration.
Yeah. IT and healthcare integration. And actually, I have been leading the team, okay, to develop the different kind of the application and solution, and by using advanced technology like AI, and also to like IoT, like many kind of different mobile and wearable device, etc., to develop the virus application, to fulfill the demands coming from the hospital and also from the healthcare as well.
Okay, very interesting. By the way, small point, would it be possible to angle the camera down a little bit so we can get a better shot? There we go. Perfect. Thank you.
Sorry.
Not a problem. One of those things. So yeah, thank you very much for your background. Out of curiosity, just from my own side, I'm not very familiar with the IoT concept. Can you elaborate on that a little bit?
Sorry, I didn't hear that.
Sure. Can you explain a little more about the IoT points that you just mentioned?
Okay, IoT device, which means, because the device before is an individual device, okay, separately. And IoT means internet.
Okay.
Okay, internet connected with the devices.
Got it.
Which means, some kind of, for example, for the blood pressure measurement. Okay, before it just measure your blood pressure. Okay, and maybe you just see the number, the figures from the machine. But right now you can have the the capability like with the wireless radio or Bluetooth radio, and to connect with the internet. So all the all the analog data will transform into the digital data. Then can transmit to to somewhere else, where maybe to the doctor's database or something. So you can integrate with the different kind of the solution, and to make all the such kind of information to transmit more quickly. Yeah.
Okay, I understand. Thank you. That is
No problem.
fascinating. So moving kind of to our topic at hand today, I'd like to touch a little bit on sort of your experience working in Taiwan during the recent global situation. So within that, the countermeasures for coronavirus in Taiwan seem to have been mainly led and planned by the government. What were some of the reactions or some of the feedback from citizens regarding that?
Actually, because before, I think in the 2003, we have a very a lot of experience from SARS. And that pandemic caused a lot of deaths. So since then, our government has set up the centralized command center, for the control of the infection or some kind of disease. So because that kind, Taiwan is quite small.
Sure.
And it's quite crowded. So the information, is spread very quickly. So especially for such kind of a disease, when as long as it has an outbreak and spread out, so everybody will get very nervous. So the things are the SARS. So everybody, most of the people they obey and follow what the government doing. Yeah. So I think for the population here, the discipline, I think, is quite okay, and awareness, to be controlled, or to be limit some the behavior or something, in the public. It's still acceptable.
Okay. So in general, do you think people start to, as you say, limit their behaviors by themselves, even without the government orders or requests, or is there usually a government message first and then the people just follow that naturally?
It's a very good question. Actually, of course, the center, they have the protocol, they have a guideline, and especially starting from the outbreak, I mean a global outbreak of the COVID-19, we have the daily conference. Every day. So every day, the center will announce the new cases or new protocol and new guideline. But because right now, starting from the mid of May, Taiwan is now facing more critical situation than before. So I think the around 20th of May, we have announced a very severe level of the control. It's a level 3. It's something like a semi lockdown. But the people still can go out. It's no problem. But as long that you can see all the street, nobody. Most of the people, let's stay at home. It's very interesting. So I think not only from the government and also from the population themselves, they are quite self-disciplined, to follow some kind of rule, just try to control. Yes.
Also, so one comment you made before, I'm curious, you said level 3 is like semi-lockdown. What do level 1 and level 2 look like?
Level 1, level 2, actually I have, hold on. We have the different level. We have a 4 level, and level 1 and level 2 it's still people can go out, and they will control the population indoors, like within the 500 people or something like that. But with the level 3, it's a the limitation, for the people gathering. You will limit to 5%.
Okay.
Indoors, and
Okay.
outdoors is a 10%. I have a slide I can share to you.
Oh, yeah, please.
Hold on. Well, where can I share?
I think there should be a share screen button.
Yeah. Can you see?
Yes.
Can you see my screen?
Yes, I can.
Okay, so you see, I'm sorry, it's all in Chinese. Okay.
That's okay.
Actually, okay. See here. So we have the academic warning label. Okay, we have 4 different label, and this label, this regulation is set up by the government, by the center, and announced to the public. And for the 1 or 2, we have some kind of the criteria. For example, as long as there's a few cases in the community, okay, so we will ask the people to wear mask when you take the public transportation, for example, okay. And if we have the for the second level criteria, if we find there's a the confirmed source is unknown, we don't know where the source coming from, so we will, to limit the people indoors. 100 people is a you cannot do the to gathering in the indoors, and the outdoors is a 500. And right now it has a semi lockdown I'm talking about, which means if we have the the 3 different events for the community infection, which means at least a community infection will be taking place like in Taipei, in Taichung, the different city, okay, for 3 or above different events. So the people, they have to wear the mask all the time when they are going out, and it's a prohibit, okay, to have the people indoors, the 5% gathering, and outdoors it's a 10%. And for here, some of the restaurant, they are not allowed, to have the the business. Maybe you just can't take out. Okay, that's what we are doing right now. And then, like you said about we have announced the level 3 on around the 20th of May, and which means it happens to there's a weekend. 2020 is a hold on. There's a 22nd. It's the weekend, and you can see. Can you see the screen?
Yes.
You can see.
There's
nobody.
No one. Wow.
Nobody. It's a yeah.
That is amazing.
You see, there's a subway here.
Yeah.
And a subway station, and here it's a very famous, in the west part of Taipei, we call it a Ximending. If the people they have visited Taiwan before, and here's a 101 area, and no cars, and no people, very, very few people.
Wow.
And here is the temple, and the temples are not allowed, to enter. You can only worship from outside.
And this was after the level 3 was announced.
Yeah, after the level 3.
Okay.
And also we have the different protocol, okay, for the level 3, for for the school, okay, and the Ministry of Education, they will announce another protocol for the school, how you can have the course for the students, so that they start to have the teleconference for I think lasting for until the mid of June. Okay. And also we have the protocol for the healthcare system, I mean for the hospitals, which means the hospital needs to start to, because all the medical resource will be collected by the center, because you have the severe cases, okay, and you have the cases is not so severe. So some of the cases, they will be sent to the different city, the hospitals, okay, and also the government, they will ask the medical center, okay, to spare at least 10% of the beds okay, for
Okay.
to treat the COVID-19 patients.
Oh,
So we
okay.
have the different protocol, and here we have also the protocol for the general enterprise. Okay, if you stay at home and working at home, what kind of the rule and what kind of the guideline you need to follow, or what if you face the emerging case, for example, if there's someone in your enterprise, in your company, okay, they got infected, what can you do? So we have also the protocol. Yeah.
Huh. That
But still, we are still fighting.
Right. That is very interesting.
Yeah.
Something else that this makes me wonder, especially seeing those photos of just completely empty streets.
Yeah, it's here.
Do you think kind of average people in Taiwan have ever started to get, what should I call it?
Nervous?
Maybe emergency fatigue, let's say.
Yeah, sure, of course.
I think in Tokyo, especially last year when everything was still very new,
yeah,
everyone was really careful all the time about not going outside and isolating and things like that.
Yeah.
And the longer it went on, I think the more people started to act more normally again.
Yeah, it's true. It's really true. Yeah, because, this is the first week.
Sure.
Okay. And of course, it takes around 2 weeks. And right now it begins to have the third week of the, some kind of the level 3 duration. And but you can see right now, starting from the third week, people, they cannot stay at home not any longer. So some of them, they will go out. And but still, okay, the people, they are still very control themselves.
Okay.
Not to going out, except they need to buy something.
Sure.
Yeah.
So still avoiding groups and not gathering indoors.
Yeah, that's right.
Okay.
And
Very
also the local city, like the Taipei city government, they also cut, the numbers of the transportation.
Oh.
And yeah, before, for example, we have the 2 minutes or 1 minute per for the subway.
Sure.
So for every time. Then right now maybe it's a 30 minutes, to make you more inconvenient.
Right.
To go out.
Right. That's very interesting. Okay.
Yeah.
So having talked a little bit about some of the government response and the countermeasures, I'm curious, as a professional in the medical field, what is your analysis, or what do you think about that response?
I think I really think because this time, right now, at this moment, this outbreak is coming very quickly, because it's a different virus. Okay, so actually, I think my personal opinion.
Sure.
I really hope can have more severe, yes, to control something.
Okay.
Otherwise, as long as because we right now all the center, they are doing one thing. They try to delay, the hospitals are loading. As long as the hospital, the medical, they crash, they will cause a lot of problem. So that's why, the center, they need to arrange the, different kind of plan to allocate the resource, all together, the national-wide hospitals. Okay, and to identify, which patient should send to where. Otherwise, it's impossible, because as long as this virus becomes very severe, and you need a team, a lot of the medical efforts to take care of them. Yeah.
Okay.
Yeah.
Interesting. Also, I just remembered at the beginning of this, you mentioned that the SARS epidemic was really a kind of like a strong memory.
Yeah, very
Taiwan.
strong memory. Yes.
After that, what do you think was the biggest thing that both the government and maybe Taiwanese people in general learned from the SARS experience?
Actually, because while you're facing to such kind of virus, sometimes, because it's right now, it's quite, it's a globalization, you are not able to avoid it. Okay, so I think for the people here in Taiwan, okay, because they learn something, maybe something like they quite familiar to some kind of symptom of this disease. So they will get very sensitive. Okay, as long as you have some cough and you got some fever or something, and they will maybe go to the the local clinic right away, and to do some the rapid testing and screening or something. Yeah. So in Taiwan, I mean, for the people, they are more sensitive.
Okay.
For such kind of the disease.
Sure. Kind of pay attention to the early signs more carefully.
Yeah, that's right.
Very interesting.
Yeah.
Okay. So kind of sticking with this topic, I think there's an impression in Japan, or in kind of global media at least, that the government in Taiwan is really listening to citizens' opinions and including that in their planning well. It seems like the government and the citizens are having good discussions about how to handle the pandemic. Is that really the truth in Taiwan? And
yeah, I think so, because I show you another picture.
Please.
But okay, you see, this is our CECC. It's a centralized command center. Okay, and really every day they have a news conference. So they have to answer, all the questions. From the media after what they report, the situation, of today, like this one, how many cases and where are the cases and where are they, their footprint or something. Okay, and when they report all this, they have to answer all the questions.
Okay.
The media, and this press conference is open, it's to public.
Really?
Yes, it's on the YouTube.
Wow. Okay.
It's on the YouTube, so you can see everybody when the time is 2 o'clock in the afternoon every day.
So if we search for CECC press conference.
Yeah. So everybody, if you have time, okay, and you can see what they are talking about, and what the media, what kind of question.
Yeah.
From the media. So it's impossible for government to hide anything.
Yeah.
Yeah. So it's quite transparent. It's quite transparent.
Okay.
Yeah, it's quite transparent. And here it's for the it's one of our local city government. In that website, okay, they post the information for every confirmed cases. Okay, for example, what is the relationship, okay, between the different cases, and when the dates, okay, and you can see here where their footprint of each cases, which means to remind the population, if you have been to the same location at the same time, you have to be very careful.
Yeah.
And what are they doing, for those cases? For example, okay, some of the case, the family, they are already isolated. And some of the cases, let's say, how many cases let's send to the hospital. So all the information, you really can see the website of each local city government.
And so that's for each city?
Yeah, for each city, because each city government, they have their own website.
Okay. That is very interesting. Actually, this topic of communication is an interesting point to move to another question I have, which is talking about the IT side.
Yeah.
Why or how did any new apps or any new technology to track the virus develop? And maybe was that also related to anything that was learned from the SARS experience, or is it all very new ideas?
Okay, I think the traceability, for to fight with this disease is very important, So for the IT side, you can see, for example, okay, from starting, okay, I can share this slide after. I can send this to Leo.
Okay, yeah, please.
Okay,
and by the way, thank you so much for preparing these. This is amazing.
Because I'm thinking maybe it's easy to understand.
It is. It's fantastic.
It's easy to understand. Actually, we have the quarantine system, from the people coming to abroad when they arrive, okay, to the border, and we have such kind of the system. And after that, of course, if they are coming from the abroad, they need to have the home quarantine. So we have the home quarantine tracking system. Okay, and in this system, we have the, they will download the app. And this app will connect it to the CDC, it connect to the center, the call center of the CDC. So every day you will receive a message, the care message. So how are you doing? Do you have the fever? And blah, blah, blah. And your location, okay, is also monitoring by the digital fencing, the tracking system. Okay, this is one of the IT we have applied.
Okay.
And of course, during you are staying in home, and there's also protocol for the local health bureau, and they need to do some care and support service. Okay, so then we have the local government hotline. And they will, they some special team, to arrange your meal. Okay, and they has somebody will collect your garbage.
Wow.
The different kind of cares and support. And because as long as you are suspicious cases, you are not allowed to take the public transportation. So we have the, the special taxi. Okay, to take you to to the hotel or to the quarantine hotel or to your home. Okay, and another thing is okay, I think this one should be everybody more familiar. It's the face mask.
Sure.
Yeah. Because we have the IC card. Everybody has it since you were born. Okay, so at the beginning, we are very lack of such kind of resources. So we just government, they just also to allocate together, centralize all the resource and distribute to the different city and to the end to the personal user. And so we use the IC card. Okay, and this IC card, because in Taiwan, the drugstore, the clinic, and the hospitals, the system all already connect to the IC card system.
Oh.
Okay, so you just go to the drugstore, for example, nearby your house, and to buy the mask. And of course, you download the app, and then the app is already it's a government developed app. Okay, and you just download it, and you can connect to your IC card. You can buy you can buy the mask.
Okay.
And another thing is we also have the map, the info. Okay, you can see very quickly. Okay, where this website is also announced by the CDC. Okay, by the government. You can if you think you feel you yourself, okay, are very suspicious, then you can find the a test center nearby your house from this map.
Okay.
Okay, and this is of course it is nationwide, and for each local city government, they have also such map. Okay, and here is a self-broadcasting messenger. As long as there's a very critical situation, like I think just this time, okay, and last year, as long as there's a very big numbers, okay, of suspicious cases, so the government, they will cooperate with the operator,
right?
Okay, and to send you the message, and to tell you only you can receive the message, nobody else.
Oh.
Okay, so no one will know if you receive or not. If you don't tell anybody you receive it, nobody will know that.
Right.
Okay, and they just remind you. Okay, tell when you receive such kind of a message, which means maybe you appear the same time or the same location with the confirmed cases. Then you have to do 1, 2, 3, 4. There's a protocol.
Okay.
Okay.
That makes sense.
Yeah, that's
Very
a
interesting.
another thing.
Also,
Here's the-
actually, on
yeah.
the topic of IT, we got a really interesting question from the audience.
Yeah.
That Japan tends to struggle with IT literacy, especially among older people.
Okay.
What is Taiwan's IT literacy level, and what kind of initiatives does the government implement to educate the population?
I think for the HP population, of course, they are not very familiar with the, the smart solution or something. But, because from here, okay, you need to buy the mask. Okay, so you need to download the app. So I think actually the smartphone, okay, for the aged population right now in Taiwan is quite popular. I have to say.
Oh, interesting.
Yeah, I have to say that. And because we have the 4 different operator and to compete. Okay, so Taiwan's population is not so huge like in Japan. We have only 23 million populations. So the competition is very high. So the mobile phone is very cheap. So yeah, it's very cheap.
That makes
so
sense.
there's a lot of subsidy package with the mobile phone from the operators. So actually for the age people, they are quite okay with the smartphone. My father, he is already over 80 years old.
Okay.
And he still use Line.
Wow. That's fascinating. Okay.
And I ask many of my friends the same. Their parents also use Line. So because we got our government, if some such kind of the footprint, the message of course is the SMS, and such kind of we have the required registration, which means that you need to
I think I lost your voice. Can you still hear me? I cannot hear you right now.
But I'm here.
There we go.
Okay. It's okay?
Yes.
Okay, you see, for example, like this, the required registration, which means, okay, whenever you enter into the public transportation or into the store, they will ask you to, scan the QR code.
Oh, interesting.
Yes.
To say that I was in this location?
Yeah, that's right. And this message was sent to the center database of the government.
Oh.
And, such kind of the application like this one, or like the mass purchasing, the government all use the same app, all the same app.
Okay.
Okay, they don't want to to bother more, because you download a different app, they will cause the more difficulty for people to use it.
Sure.
And for such kind of a required registration process, it only takes 3 or 4 seconds. So it's quite convenient.
Yeah.
Okay. So we have the different kind of things, and right now, hold on. What's going on? Okay. And for now, hold on. Okay. Because right now, what we are doing right now, another IT technology also by developed by this guy. Okay. The town phone, the Audrey. And we are doing the vaccination platform.
Okay.
Using the same mechanism.
Oh.
And yes, and which means you can register and in advance. Because right now Taiwan has the difficulty to have the vaccine.
Really?
Yes, because of some political reason.
I see.
Okay, and it really sense, because we just learned that the Japan government, they will donate the 1 million, I think 1,200,000 AZ vaccine, and they will arrive to Taiwan this afternoon.
Oh,
It's really helpful and really grateful,
sure.
because because we really have a big problem to purchase the vaccines from from United States and from otherwhere. And here, as long as the more and more the vaccine arrive to Taiwan, so our government, they have the vaccination plan, which means they will collect the hospitals and the local health bureau and then clinics, okay, and to arrange, okay, to set up the different kind of the vaccination station, and to achieve the certain amount of the people who got the vaccinated. And this one also will be integrated. Okay, such kind of information also will be integrated into the vaccination platform. And that's what we are doing right now, which means as long as when the vaccine arrives to Taiwan, now everybody, if you want to take the vaccine, you just, to register from the platform, then you can show where the clinics or where the station nearby your house, okay, and when you can take the vaccine.
Okay.
That's what the platform we are doing right now.
And it's all connected to the same system.
Yeah, it's all connected to the system.
Very interesting.
Yeah.
Okay.
Yeah. This is why we doing some of the application here.
Yeah.
Yes.
That is fascinating. So we've talked a lot about these very kind of focused measures to try and deal with this situation. Do you think there have been any cases that were less successful or outright failures that have been learning experiences for the government?
Of course, because I think because right now everybody talk a lot, okay, why there's a outbreak. It's because it's because we have the different protocol for different industry, okay, and but in general, okay, whenever you're coming from abroad, you need to have the 14 days.
Right.
14 days quarantine.
Isolation.
Yeah, isolations. But I don't know for what kind of reason they shorten. Okay, we have the 14 days, which means 7 days isolation and 7 days self-health management monitoring. Okay, and during the self-health management monitoring duration, you still can go out, but you need to wearing the mask.
Sure. And
it's a 7+7. Okay, and for the airline companies, it's the same for the pilots and for the crews. Yeah, of the airlines companies, the same. But we don't know why they change. Okay, to 3 days plus 11 days, which means which means the crew can just stay isolated 3 days. And in the, for example, at the quarantine hotels, and that's also the starting point, okay, for the the infected cases from the hotel this time, and spread out to other community. Yeah, and so of course, I think it's a very big how to say it, very serious mistake, I think, from the government this time.
I see.
Yes.
And so that was changed recently or some time
ago?
They
changed already.
Okay.
They changed already. They just they just changed back to the same, okay, as before. Okay. Yeah, I think there's one thing I have to say that because this centralized command center, they have actually, you see, okay, hold on. Even though you see every day their faces, okay, every day they have the press conference to face all the populations in Taiwan, but actually they have an expert, they have a team expert behind them. Right. I remember it's around, I don't know, it's 30 or 50 different experts coming from the public health, coming from the medical, coming from the biology, from a different domain, to give them the consultation for every protocol and every guideline or every decision making. Okay, so they are not only few people, or they are not only one person, to make the decision. Okay, it's a group, it's a expert groups. So they call that, for such kind, this time, this is a mistake, they change and very quickly. And they are doing some kind of the rolling, the monitoring, to see according to the situation, okay, of what happened today, and to change the policy, to change the measure, or to change the protocol. Yeah.
So this group of, you said about 30 to 50 advisors, they actually have a lot of influence.
Yeah, they have. They have. This one is our Minister of the Health. Okay, he is the leader of this center.
Okay.
And he cannot make the decision by himself.
Okay.
Okay, and the very important decision have to be met, by the majority of the advisors.
Oh, interesting.
Yeah, and they have the meeting every day. Every day. And right now, because this time the outbreak, and actually the center has the meeting every day with the mayor of the local city government every morning.
Okay.
Just try to to design what kind of protocol and to see the situation and to understand what kind of resource, okay, for the local city government they need.
Okay, so what I hear is, in sort of this center system, there's a very big importance placed on both listening to the advice of the experts and then also being transparent at every level, from inside the government to also talking to the citizens.
Yeah, that's right.
Very interesting.
Yeah, because sometimes the media is not easy, to handle. And some of their questions are very sharp.
Yeah.
Yeah, and everybody see what kind of question proposed from the media, and what kind of answer the center they give to the media.
Yeah.
So it's very, very transparent.
Oh, we actually have a question from another Taiwanese viewer. Thanks for
Already?
joining, Alice. Yeah. She says, thank you so much to present Taiwan's policy. Is there any plan to stop the bad rumors about the AZ vaccine? My mother still believes it is dangerous and refuses to take the vaccine until other brands come in.
I think it's not so easy, even a lot of medical experts, a lot of, they have to do a lot of comparison, between the different vaccines. But well, I don't know. Still, because whenever I think it's okay. There's another thing I think is quite sad is at this situation at this point, still have a very few people. They have their private interest. Okay, so they will spread out some kind of rumors or some kinds of the wrong information to the public. And as long as if you just feel, if you check the different information, okay, you will see they are wrong. It's not incorrect. But for the aged people, it's very difficult.
Sure.
How could you to make them understand such kind of difficult medical information?
Right.
Yeah. So sometimes the doctors here, actually the every day, the team here to face the press conference. Here, he's the doctor coming from the National Taiwan University Hospital. And he will explain, something. Yeah, very. And also our minister, he's also a doctor.
Okay. And
the others, they are the background, they are all public health. Okay, of course, they will try to explain. But no matter how, believe, still believe. And if you don't believe, you still don't believe.
Right.
Yeah, sometimes a little bit difficult. I'm sorry.
It is the sad truth, but
it's a sad truth. Yes.
That does make me think, though. So speaking from my background, watching what has happened at home in the United States, where there has been controversy about everything from masks to isolation to vaccines. have there been very many of these kind of rumors spreading or just
Yeah.
misinformation within
Yeah.
the Taiwanese community?
I think still the same. I think, because especially, we have been a very happy time, for the past years, for last year, since last year and up to the beginning of May. Okay. And right now, I think this time is the first time very serious, the outbreak. So everybody get panic. And especially we don't have enough vaccine.
Right.
Okay, so everybody get more panic. And at this time, if someone they have some intention or some interest, they will manipulate some kind of the website and some rumors, some information. So I think it's the same. But at the end, I think I believe that most of the people in Taiwan, they are still very reasonable. Okay, so they can see they can identify what is correct, what is incorrect.
Right.
And some kind to fight with such kind of disease, it takes time.
Right.
And sometimes at the end, time will tell. Really, time will tell. Yes.
I will say I really like this focus on transparency and communication. I think that does create an environment where these rumors, it's much harder for them to spread as quickly. So that's
actually, we have I think starting from this outbreak, this is a press conference every day, right? In the afternoon, 2 p.m. And there is another one in the morning. Okay, just to announce what kind of the conclusion the government and the local city, they have met together. It's one thing. And the other thing is, to tell the people which rumors are not correct.
Okay. That sounds very valuable.
I don't know, it's still a lot of rumor, of course.
Yeah.
So you need to clarify.
Absolutely.
Yeah.
Very interesting. Actually, this is a good transition to kind of my last question here, which is, do you think there's any advice in terms of mindset to handle this kind of crisis in the future, maybe that people can learn from Taiwan's example?
I think okay. I think one thing is centralized command organization is very important. Okay, and the second is like you said, transparent. The information, to let everybody knows right away is also very important. And I think but I think it's quite a little bit different. It's because maybe it's not suitable for every country or everybody. Because Taiwan, they has a very special healthcare insurance system.
I see.
Okay, so the government, they really have the power, to order, to command the hospital. They have some kind of the weapon, I have to say that.
Sure.
To ask the hospital to follow. For example, like this time, they have ordered the medical center, you have to spare 10% of your beds to do something. I think this is not easy for other countries because of most of the hospital, they are private owned. Yeah. And I think the self-discipline is also the I think it's quite good. I mean in Taiwan.
Yeah.
And but I think it's also the different, the culture. You are not able to ask everybody to do the same. But I think the most important is that you need to have a centralized the command center, and where you set up the protocol, okay, for different different category of population, a different industry or something, and then ask everybody to follow it. I think it's very important.
Powerful words. All right, we have about 10 minutes left, and I want to use our remaining time to open it to any questions from the audience.
Sure.
And actually, we have one coming in already.
Already.
Yeah. How have businesses in Taiwan reacted and adapted to the pandemic? Have there been any innovative initiatives, or has there been a significant shift in working style?
I think right now, I think both. Okay, because right now at this moment, most of the companies, we start to work from home. Okay, we start to work from home, and a lot of the like a restaurant or like a store, they close. Okay, so for this point, to support such kind of industry and such kind of small business, okay, our government, they have announced very quickly a kind of subsidy plan project
for businesses that have to close
for business and for individual as well. So I know I think the lawmaker, they passed the budget already last week, and starting from yesterday, some of the individual, they start to receive the money from government.
Wow, so that's what, less than 3 weeks since the level 3 announcement?
Yeah. So you need to react very quickly. Otherwise, the complaints and everything, they will arise very quickly. And right now, I think of course, they hit the economic situation right now in Taiwan for sure. Okay, but for the manufacturer, I think I see it's still running and still operating. It's not affected so much. But for the small, the business like a store, restaurant, something, yeah, it affect a lot. Especially for the traveling agency or something, it affect a lot as well. But they all have some reimbursement or some subsidy from the government.
And do you know, is it announced if that will be a one-time subsidy, or will it be continuing if the lockdown continues?
Right now it's a one time.
Okay.
For 1 month.
Okay.
1 month to just to support you, to maybe I think it's a 1 month or 2 months. I don't remember.
Okay. Very interesting.
But for the business, they have the tax, the policy for for the small business. It's for the long for the annual.
Sure.
Yeah.
Okay.
Policy. Yes.
Interesting. We have another one. While the Taiwanese government is taking some great leadership, do you hear any complaints or any troubles from Taiwanese citizens about the measures and actions that the government takes? And if yes, what kind of things are they?
You mean the complaints to the government?
From the citizens about government actions.
Of course, just like I said, the policy for the airlines company, they complain a lot. They really complain a lot. And the second thing is for the vaccines, yeah, because everybody gets a panic. Okay, so they don't care about, because of the political issue or political problem, you just cannot buy them.
Right.
So I think it's a very hard situation for our government. Yes. I think those two things, they complain a lot.
And what is the usual government response to that? Just say, I'm sorry, we're doing our best, or?
Of course. And, for the vaccine, of course, they have to, they can only set, we try, really try, and tell them, and tell the population, tell the public, what kind of the process they have done.
Right.
And for some reason, still, they are not able to release, some confirmed purchase cases, because, if you release to the public, there will be some, to cause some problem as well. So I think it's quite hard for situation for them. Sure. And as for the, the change for the quarantine duration, and right now they change. They change, yes.
Oh, this is a very good question. Does the Taiwanese government take any specific care or any support for foreigners or expats who live and work in Taiwan?
I think what kind of the special cares you mean for the foreigners? Because all the cares, for example, hold on. like if you have the isolate or you got suspicious, okay, you have the self-health management or isolate quarantine at home, you have the same treatment like other Taiwanese people do.
Okay. I guess because everyone has that same card.
Yeah, the same.
Yeah.
And even for the foreigner, they have the the list card, the insurance card. We have the insurance card for foreigner as well. Okay, so all foreigner they can use this card to see the doctor in the hospital.
Yeah.
They can also use this card to buy the mask and everything. And especially for the apps or everything, it's open to everyone. And especially, for the foreigners, we have the, whenever we have the different protocol and very important protocol, we have a different language.
Ah, okay.
Yeah, we have the English, I think the Japanese maybe, and also the Vietnamese and the
Really?
Wow. And the Indonesia.
Wow.
And because we have the the foreign neighbors.
Yeah.
At the factories, so we have a different language.
Sure.
Yeah, to make them understand how to protect yourself.
Sure.
Yeah.
Okay. Very interesting. We have time for maybe one or two more questions if there's anyone else in the audience who has anything they'd like to ask today. This is great stuff so far. Thank you all very much for your questions, by the way. Anything else anyone would like to bring up? Also, actually, Phyllis, from your side, is there anything else you've prepared you'd like to share with everybody?
I think, hold on. Wow. You see this? I think I have to say more. The slide I have. Okay, I think it's just some measures. Okay.
Okay.
I think it's also I think it's quite similar to other countries as well. And also it's our measures, okay, for the home quarantine isolation. And here is the tracking management, okay, for the high risk cases, okay, for the people we have the high risk to get infected. So we have the different kinds of the category. Okay, for example, you have the home isolation, and you have the self-health management, etc. We have the different, and what kind of the protocol, what kind of rules you need to follow. So it's I think most of the people right now, they know that. And this one is also for the, the enterprise. Okay, as long as they have the employee who got infected, or they need to do something, they have the rule to follow. And this is a social distance. We have to, do a lot of the promotion to tell people, not to get close.
Right.
Yeah, and it's a social, practitioner in the school, in the public area, and also the, in the restaurant as well.
Okay.
Yeah.
Okay, we have two final questions.
All right.
First off, in your company, have you changed or adapted your communication style with your employees? Or any tips on communication techniques in a crisis?
I think, of course, we have changed a little bit, because most of us right now, we are working from home, and we use the teleconference. But I think most of the company, I think in Taiwan, are quite, get used to the teleconference. For example, for our company, we have the office in Taipei, because we are a hospital system, and we have a hospital in Taiwan from the north to south. So the the teleconference is a daily operation, one part of data operation for us. But of course, because we are working from home, sometimes you need to visit some kind of face-to-face discussion. They will need to be canceled.
Okay.
I think there will be a little bit change for that.
Sure.
But from my personal experience, it's not affect a lot to the business. So far, it's okay. But I'm sure for some companies, they do have affect a lot. For example, like the banking, some kind of the activity you need to do, on site. So I think, it's a depends on what kind of the category of industry.
Interesting.
Yeah.
All right. And then our final question for this afternoon. How is the reaction of people who are involved in the medical field, such as doctors and nurses? Do you think they're ready and they get enough support on an operational level?
Okay, I think because this outbreak coming very quickly, so at the beginning, I don't think the support for the medical staff is enough. But right now, just try to catch up the support. But for the medical staff, I really appreciate. I'm very grateful, for them, because I have a lot of friends. Their daughter, their son, they are doctors. They are doing, the rapid testing, in the emergency room, and they don't come home. They stay at the hospital.
Oh, wow.
They stay at the quarantine hotels.
Yeah.
And I think that's why I really respect them a lot. They know they have very high risk of infection.
Right.
And they still, they just do their job very good, and they try their best, to serve the people. Yeah. So right now at the beginning, the support is not so sufficient, but right now it's better and better.
Interesting.
Yeah.
Thank you. Well, thank you all very much for your questions. And of course, Phyllis, thank you so much for joining as our guest today. This was amazing and really just a fantastic education.
Thank you very much for invitation, really. It's really nice to share all of them with you all.
It has been a great pleasure. I suppose all that's left for me to say then is, again, Phyllis, thank you so much for joining us. Thank you all for listening in this afternoon. We hope to see you again in any of our future Spark Dojo events.
Okay,
Have a good afternoon.
Thank you very much. Thank
Goodbye.
you. Thank you. Bye.
Bye.
Take care. Take care.